Doctor, what exactly is fatty liver disease?
Fatty liver disease is a condition in which neutral fat is 30% or more of the liver cells. This disease is on the rise globally,
I
with
see.
the highest prevalence in the Middle East and South America. It is said that 30% of the Western population has fatty liver disease.
That's a really high percentage.
If this condition is left untreated, it may cause the liver to become fibrotic or scarred.
I see.
Accumulation of neutral fat in the liver cells is the cause of fatty liver disease, but having small amounts is normal. When excess fat builds up, your liver cells become swollen like a balloon. This condition is called fatty liver disease. The swollen liver cells press against the surrounding tissue. When this happens, it can cause inflammation in the compressed cells. The inflammation in the liver cells results in cell death. The dead cells turn into collagen-rich fibers which accumulate in the liver. This is called fibrosis. As fibrotic tissue builds up, it can progress into cirrhosis in which the liver hardens. And eventually, this can lead to liver cancer.
Dr. Izumi, what are some possible causes of fatty liver disease?
The leading cause of the fatty liver disease is obesity
Hmm.
due to overeating and lack of exercise. There is also alcoholic fatty liver caused by consuming too much alcohol. Drinking at a harmful level is also the cause of the liver cell damage that leads to fibrosis. Furthermore, poor eating habits can also cause fatty liver disease. For instance, eating on irregular schedule, eating between meals, or extreme diets, which explains why we see fatty liver disease in lean people.
I see. Among the different causes, alcohol consumption seems to be the most damaging.
Yes, that's right. We need to be aware of the damaging effect of the excessive drinking. However, people who don't drink are not necessarily insusceptible to liver damage.
Oh,
Recently, studies have found that people who drink little to no alcohol also develop cirrhosis and liver cancer.
really? Can you explain that a little more?
Yes, it is a form of fatty liver disease and called non-alcoholic steatohepatitis or NASH. It is especially common among women in middle ages or older. 10 to 20% of people who are diagnosed with particular type of fatty liver disease, NASH, have been reported to develop cirrhosis 10 years later.
So that means that if you are diagnosed with NASH, there is a high risk of getting cirrhosis. Why does the disease progress even if you don't drink alcohol?
The exact reason is unknown. However, it is thought that the decrease in female hormones after menopause is somehow associated with the fact that the condition is relatively common among middle-aged women and
I
older.
see. Now, how do you find out whether you have NASH or not?
A liver biopsy is performed to diagnose NASH. Ultrasound images are used to locate your liver. The doctor will insert a biopsy needle through the right side of your abdomen into the liver and remove a small piece of tissue. It is then soaked in a special stain. Here are the results. The image on the left is a normal fatty liver, known as simple fatty liver, which typically does not get that enough to cause liver damage.
I see.
On the other hand, the image on the right is NASH. The parts that are blue are places that have become fibrotic. The wider blue stain indicates the more advanced progression of the fibrosis.
What should we do if the tests show that we have fatty liver disease or NASH?
Currently, there are no effective cures for NASH or fatty liver disease. Therefore, improving lifestyle habits is the best treatment. For people who don't drink, overeating or snacking is often cause of NASH and fatty liver disease. Exercise and healthy diet are said to improve liver health.
Really take it more seriously. What kind of exercises are recommended?
Until recently, cardio exercise such as walking had been recommended.
I see.
But now, studies have shown that adding strength workout on top of cardio exercise is more effective for improving liver health.
Strength training for reducing fatty liver. Today, we will introduce 3 types of strength training workouts. First, let's start with squats, with strength in your glutes and thighs. Cross your arms and place them on your chest. Straighten your back. Now bend your knees as you push your buttocks back. Then press through your heels to stand back up to the starting position. The second exercise is bowing, which strengthens the muscles on your back. Cross your arms and place them on your chest. Keep your back straight as you tilt your upper body forward. Then come back to the starting position. Make sure not to look down, but keep looking straight. And finally, tippy toes. This will help you strengthen your legs. For this exercise, you'll need a chair or a wall to help support your body. Slowly raise both heels off the ground and bring them back down. This exercise should be performed about 10 times a day.
Why is strength training effective for treating fatty liver disease? It doesn't really seem very directly connected.
Muscles are said to be the second liver.
Really?
Because your metabolism goes up as you build up more muscle. Particularly in metabolizing sugar, the source of the neutral fat, the skeletal muscle is responsible for taking up 70% of glucose in your whole body. So increasing muscle mass through strength training will ultimately help reduce the liver fat.
You also pointed out that healthy eating also helps reverse fatty liver. Can you give us some tips on this?
Yes, there are some individual differences. So you should first consult a dietitian.